will be reviewing a study by J.S. Greenstein and colleagues titled The Effects of a Closed-Chain Eccentric Training Program on Hamstring Injuries of a Professional Football Cheerleading Team. The study includes 43 professional cheerleaders of the Washington Redskins NFL team. Background research suggests that over the previous 2 seasons, hamstring injuries were prevalent in 31% of the sample. The most common mechanism of injury is the drop-split maneuver, or the drop-jump maneuver, as seen on the right. This maneuver requires the cheerleaders to jump into the air and then flex their front hip at 90 degrees, full extension of the front leg, while their back hip is in full knee and hip extension as they finish in a split on the ground. This creates a great demand on the biceps femoris muscle. This maneuver typically results in muscle strain injuries of the hamstring, also the biceps femoris, and muscle strain injuries occur when muscles are actively lengthened to greater than normal lengths, as seen in the drop split maneuver. The hamstring muscle is a biarticulated muscle which crosses 2 joints with 2 major actions. The semimembranosus, the semitendinosus, and the biceps femoris are the 3 muscles included in the hamstring. The biceps femoris connects the ischial tuberosity of the hip to the lower leg at the fibula. The hamstring is responsible for knee flexion and hip extension. A closed kinetic chain includes a linear stress pattern in which movement occurs at multiple joints and multiple joint axes. There is simultaneous movement at both segments and an increase in muscular co-contraction. An eccentric muscle action is the portion of a muscle action in which the muscle lengthens. Now that we have some background information, we can discuss why Greenstein and colleagues conducted this study. The purpose of this study was to measure the effects of an eccentric, closed-chain exercise intervention on hamstring injury and associated pain during the course of the football season among professional football cheerleaders. The participants included 43 Washington Redskins cheerleaders. Their ages range from 18 to 34 years old, with the mean age being 25.6 years old. Their professional cheerleading experience ranged from 1 to 8 years, with the mean being 3.23 years. Data was collected through an injury survey to identify location, chronicity, and severity of injury, in addition to the relationship of injury to cheerleading experience and epidemiological variables collected at 3 different time points. These time points included June, after team selection, September, after preseason training prior to the intervention, and in December, after football season and after the eccentric closed-chain hamstring exercise intervention. The eccentric closed-chain exercise intervention ran for 17 weeks, from September through December. In Table 1, you can see the sequence of sets and repetitions for the hamstring exercise protocol. The exercise protocol utilized TheraBand loops for the implementation of both exercises. One of the exercises was a split stance eccentric hamstring exercise, which I would think of as a RDL because it's a hip hinge. So with the split stance, the TheraBand loop was around the forward foot, and the athlete hinges at the hips to create a stretch in the hamstring muscle and then returns to standing position. The second exercise, described as a single leg eccentric hamstring exercise, looks to me like a single leg RDL, where the TheraBand loop is around the foot that is planted on the ground, while the other foot reaches back as the athlete creates a hip hinge movement. Now, this exercise was only performed by the cheerleaders who did not report hamstring injury. These exercises were completed 2 times per week under supervision, and the athletes were encouraged to perform the exercises at home 3 times per week. It is unclear as to how many athletes adhered to the 3 times per week at home. Results. So, during the course of the study, 15 cheerleaders reported hamstring injuries at some point. This is 35% of the squad. In June, there were 11 injuries. In September, there were 15. And in December, there were 15. Of the 15 athletes who were injured, 13 of them sought multimodal treatment during the course of the intervention. This treatment may have included athletic training, physical therapy, or chiropractic treatments. I believe that because so many athletes who were injured sought multimodal treatments, it is difficult to determine whether the exercise intervention actually worked or not. We don't really know if the eccentric closed chain intervention worked for the athletes or if the additional treatments worked. However, the researchers did find that there was a positive correlation between age and pain in September and December. ANOVA results indicated a significant decline in pain for the 15 injured participants from September to December. Their pain levels declined by 50%. So as you can see in the graph of Figure 3, the intervention appeared to be effective in reducing hamstring pain among the cheerleaders between September and December. Their pain decreased by approximately 50%, which is a significant decline in pain during the exercise intervention. Some limitations of this study were that it only included one group of athletes. It was a very small study with only 43 cheerleaders. I think it could have been more beneficial if maybe they incorporated 2 or 3 teams in the area. They could have probably done the study with the Philadelphia Eagles cheerleading team, the Baltimore Ravens. So having more than one group of athletes in the study could have improved it. In addition to the study being fairly small, the decline in hamstring injuries may have also been due to other factors, such as the multimodal interventions, not specifically the interventions set forth by the researchers. Another limitation of this study was that it did not include a control group. All 43 of the athletes took part in the exercise intervention. Greenstein stated that the results of this study indicate that an exercise intervention consisting of 2 closed-chain eccentric hamstring exercises practiced twice per week may have an effect on reducing hamstring-related pain. However, as discussed earlier, there was no control group, and those who did experience hamstring pain, 13 out of 15 of those athletes sought out multimodal treatments that were not looked at closely. So, while eccentric closed chain exercises may be a factor in reducing hamstring pain, we don't know if it was the only factor. Some practical applications of this study include eccentric closed chain hamstring exercises may prevent hamstring injuries among professional cheerleaders, or at least help manage pain and reduce pain throughout the season. Additionally, home exercise may further potentiate the effect of the intervention the athletes had a choice to add 3 days per week of intervention. While that was not recorded which athletes did it or how often, doing that extra work may further potentiate the intervention and prevent hamstring pain or injuries. And the last practical application is that age and hamstring pain appear to be positively related.